Hi and welcome to Sleep Assist. My name is Jeff Collings, the Clinical and Managing Director. This link has been developed to provide assistance in implementing the Philips PDX home monitoring sleep diagnostic equipment. Please allow at least 60 to 90 minutes to set yourself up. Through the steps, you're encouraged to pause this presentation, then return once you have completed the task at hand. It may also be beneficial to look through the folder first before proceeding and use it in conjunction with this presentation. This sleep test is a very important health procedure in identifying a sleep disorder that may be detrimental to your health. Once you've returned the PDX unit and relative equipment to Sleep Assist, your results will be analysed by a sleep scientist and reported on by a professor in sleep medicine. Sleep Assist will then call you when we have those results and a copy sent to your GP. I hope you have little trouble with this procedure. So sleep well and remember, good health begins with good sleep. Step 1. Unzip the bag, take everything out and lay the following equipment on a flat surface. The PDX unit with a lanyard, blue belt and pulse oximeter attached. Large blue elasticized belt with clips. A tube of New Prep Skin Prep Gel, a tube of 1020 conductive paste, cotton buds, 2 pieces of thin gauze, alcohol swabs and a roll of tape. Step 2. Read the instructions. Unzip the folder and begin reading through the instructions. This is an important step to understand what you are about to undertake, so please take your time reading the instructions. Step 3. Leg movement sensors. Take the 2 blue material ankle straps and leads out. The leads will have a rubber band section bundled up to shorten the length as they are very long. Do not remove the rubber bands as these are necessary to prevent entanglement during sleep. Ensure the leads are hanging outside of your night garment, ready to be connected into the multi-lead port box. You must prepare the skin by cleaning and removing dead skin cells, so a clear signal can be recorded. Take the tube of New Prep Skin Prep Gel and squeeze a small quantity the size of a 10-cent piece onto a tissue. Step 4. ECG leads and adhesive electrodes. Using a cotton bud dipped in New Prep, clean a patch of skin 2 inches below the right collarbone, approximately the size of a 50-cent piece, rubbing with the cotton bud for 20 seconds. With a fresh alcohol swab, wipe the area clean with 1 swipe only. Apply the adhesive electrode labelled right upper chest. Repeat this procedure on the left lower chest area using a fresh cotton bud and a fresh alcohol swab, and apply the adhesive electrode labelled left lower chest. Place your night garment on now over the ECG adhesive electrodes and leads. Ensure the leads are protruding through the top of your garment, ready to be connected at a later stage. Step 5. Abdominal belt. Carefully move the 2 chest leads over your shoulder so they do not get caught underneath the elasticized belts. Place abdominal belt around your waist. The belt will have already been personally fitted to you, so no further adjustments should be required. Ensure both female ports located in the clips are facing upwards. Step 6. Thoracic chest belt. Place the recording device lanyard around your neck. The belt will have already been personally fitted to you, so no further adjustment should be required. Wrap the thoracic belt around your chest. The recording device will now be sitting above your stomach. Ensure that the two sliding Velcro patches are facing forward. Step 7. Turning the PDX recording device on. Open recording device via the latch at the top, sliding it in the direction shown on the latch. You will now be looking at a blank screen. Press and hold the power button for 2 seconds. A green light will illuminate at the top of the device. The screen will display a figure of a man. A series of zeros will flash across the bottom of the screen. In a few moments, the sensor location icons will flash. Positions flashing need to have correlated sensors connected. Step 8. Connecting thoracic belt lead. The white lead marked thoracic chest belt. Connect the two black plugs into the female ports on the belt clip as shown. Connect the blue plug of the thoracic chest belt into the PDX as shown. Look carefully as one side is flat and the other round, which correlate with the female connection point on the unit. Step 9. Connecting abdominal belt lead. Connect the white lead marked abdominal belt. Connect the two black plugs into the female ports facing up on the belt clip as shown. Connect the blue plug of the abdominal belt into the PDX as shown. Look carefully as one side is flat and the other round, which correlate with the female connection point on the unit. Step 10. Connecting the multi-lead port box and heart port box. Attach the heart port box on the strip of Velcro on your left. Then plug into the green corresponding port marked ECG. Attach the multi-lead port box on the Velcro strip on your right, ensuring the labels are facing the right way up so you can read them. Then plug into the yellow corresponding port marked EXG. Step 11. Connecting the leg movement sensors, leads and ECG leads. Locate the two white leads from the ankle straps and insert them into the multi-lead port box marked left leg and right leg. There are two connectors for each leg. Locate the ECG leads coming from the top of your night garment and plug them into the heart port box. The lead labelled right upper chest plugs into the red port. The lead labelled left lower chest plugs into the green port marked LL. Step 12. Chin, eyes, ground and ears adhesive electrodes. Using a cotton bud dipped in Nuprep, clean a patch of skin on your right side of your chin the size of a 50-cent piece, rubbing with a cotton bud for 20 seconds. With a fresh alcohol swab, wipe the area clean with one swipe only. Alcohol swabs must only be used once and then discarded. Apply the adhesive electrode labelled right chin. Repeat this procedure on your left side of your chin using a fresh cotton bud, a fresh alcohol swab, and apply the adhesive electrode labelled left chin. Insert the lead marked left chin into the multi-lead port box labelled left chin. Insert the lead marked right chin into the multi-lead port box labelled right chin. Step 13. Eye adhesive electrodes. Using a cotton bud dipped in Nuprep, clean a patch of skin on your right temple the size of a 50-cent piece, rubbing with the cotton bud for 20 seconds. With a fresh alcohol swab, wipe the area clean with one swipe only. Apply the adhesive electrode labelled right eye. Repeat this procedure on your left temple using a fresh cotton bud and a fresh alcohol swab and apply the adhesive electrode labelled left eye. Insert the lead marked right eye into the multi-lead port box labelled right eye. Insert the lead marked left eye into the multi-lead port box labelled left eye. Step 14. Ground forehead adhesive electrode. Using a cotton bud dipped in Nuprep, clean a patch of skin on your forehead the size of a 50-cent piece, rubbing with the cotton bud for 20 seconds. With a fresh alcohol swab, wipe the area clean with one swipe only. Apply the adhesive electrode labelled ground. Insert the lead marked ground into the multi-lead port box labelled ground. Step 15. Ear adhesive electrodes. Identify the bone directly behind your right ear. This is important that the black dot of the electrodes are placed on the bone and not the muscle tissue. Using a cotton bud dipped in Nuprep, clean a patch of skin behind your right ear, the size of a 50-cent piece, rubbing with the cotton bud for 20 seconds. With a fresh alcohol swab, wipe the area clean with one swipe only. Apply the adhesive electrode labelled right ear. Repeat this procedure behind your left ear using a fresh cotton bud and a fresh alcohol swab and apply the adhesive electrode labelled left ear. Insert the lead marked right ear into the multi-lead port box labelled right ear. Insert the lead marked left ear into the multi-lead port box labelled left ear. Step 16. Scalp electrodes, gold cup. As shown here, using your thumb and forefinger, identify the top of your ear and the top of your head. Locate the halfway mark between the top of your head and the top of your ear. Using a cotton bud dipped in U-Prep, clean a patch of skin on your scalp the size of a 50-cent piece, rubbing with the cotton bud for 20 seconds. Do not use an alcohol swab. Using a tube of 10-20 conductive gel, squeeze 1 centimetre of conductive gel out and place on your prepared skin. Place the labelled lead marked right scalp with the gold cup facing down onto the 10-20 gel and push down into the gel until it touches your scalp. Using a thin piece of gauze provided, place it on top of the gold cup and gel, pressing down firmly to secure. Repeat this process on the left side of your scalp. Insert the lead marked right scalp into the multi-lead port box labelled right scalp. Insert the lead marked left scalp into the multi-lead port box labelled left scalp. Turn the PDX unit recording device off by pressing and holding the power button down for 5 seconds until the picture of the man has disappeared. Close the PDX unit and reposition the unit above the heart with the blue straps around the chest close to your armpits and tighten the lanyard. You do not have to be in bed asleep by 10 p.m. The recording will show when you are attempting to sleep. Step 17. Before going to bed. With the cannula bending in towards your nose, run the tube up and over your ears and then under your chin like the drawstring of a hat. Tighten by sliding like a tie. Connect the nasal cannula tube into the PDX recording device by twisting and tightening into place. Be sure not to over-tighten and break the connector. Run the thermistor along the same pathway as the nasal cannula. The tip of the thermistor should sit just in front of your mouth. Connect the thermistor into the PDX recording device, which is next to the nasal cannula port. Using the tape provided, tape both nasal cannula and thermistor to upper cheeks to hold them in place during the night. Place the rubber pulse oximeter around your middle finger of your non-preferred hand. This means if you are right-handed, place the cap on your left hand middle finger. Run the lead over the back of your hand and tape it securely there. Also tape the lead halfway up your forearm. The pulse oximeter may already be plugged into the PDX unit. You are able to get up during the night if required. Should any electrodes dislodge, use the tape provided to resecure. Please allow 20 minutes in the morning to remove all of the equipment. Detach the sticky adhesive electrodes from the leads and discard. Place each lead in individual bags provided. Thank you very much, and this completes the procedure.